Understanding what it means to be on the Bipolar Express. Bipolar I Disorder by Sakshi Khanna.
High,
Low,
happy,
sad,
confidence, insecure,
extreme,
exaggerated, intense,
excess, irritable,
stress,
chemical,
imbalance, depressed,
manic, black or white,
all or nothing, mania, depression,
can take on anything.
on top of the world, empty,
suicidal, life, death,
suicide,
manic depression,
bipolar,
bipolar,
Bipolar.
bipolar,
bipolar.
But what really is bipolar disorder? We asked some Duke students what they thought.
So I think bipolar disorder is when someone has various shifts in moods really quickly.
Bipolar disorder, I think, is like a form of split personality. So I think sometimes you're okay, but then I think other things trigger you, so then you act differently. That's totally normal in the way you usually act.
I think there are two types, and I know that in general it entails periods of depression and then periods of better mood, but I mean honestly I don't really know much about it.
Bipolar disorder is a stigmatized mental illness.
Bipolar disorder is a mood disorder because it is characterized by gross deviations in mood. The most common mood disorder is major depressive disorder. I will focus on bipolar disorder, which includes depression from major depressive disorder and also mania. Bipolar disorder used to be called manic depression. It causes severe and unusual shifts in mood, energy level, thinking, and behavior. People with bipolar disorder often experience episodes of overly high highs, extreme irritability, and depression. While everyone has good and bad moods, the unprovoked and intense highs and lows of people with bipolar disorder can be unpredictable, extreme, and debilitating. The main diagnostic criteria for depression is depressed mood and/or loss of interest in life activities called anhedonia for at least 2 weeks. In addition, you need to meet at least 5 of the following symptoms: insomnia or hypersomnia, fatigue, agitation, feelings of worthlessness, indecisiveness, recurrent thoughts of death and suicide. The main characteristic of bipolar I disorder mania is characterized by a distinct period of abnormal or persistently elevated, expansive or irritable mood lasting at least 1 week. During this period of mood disturbance, at least 3 more of these symptoms must be met: increased self-esteem, decreased need for sleep, more talkative than usual, flight of ideas, distractibility, increase in goal-directed activity, excessive involvement in pleasurable activities that have a high potential for painful consequences. There are 4 major types of bipolar disorder. Bipolar I is characterized by manic and/or mixed episodes and at least 1 episode of depression. Bipolar II has depression plus hypomania. Cyclothymic is chronic but mild depression and hypomania. Unlike other mood disorders, bipolar disorder is equally prevalent across the sexes. Women, however, show more rapid cycling, which is a severe variant of bipolar disorder which is resistant to most forms of treatment. In this, the person has 4 or more manic or depressive episodes within 1 year. Women also present more with depressive episodes while men show more mania. The peak age of onset of bipolar disorder is between ages 15 and 24. If the onset of symptoms occurs after age 60, the condition is probably secondary to other medical causes such as sclerosis, hyperthyroidism, and epilepsy. Bipolar disorder is characterized by intermittent episodes of mania or depression. In between these episodes is a euthymic interval in which the person returns to their normal state of health. Early on in the course of the illness, the euthymic interval shortens and the episodes appear progressively closer together. Over time, however, the duration of the euthymic interval stabilizes. Aside from the cyclical pattern, some people experience a seasonal bipolar disorder, where depression is common in fall and winter and mania in the spring and summer. Most importantly, the cause of bipolar disorder is chronic. Substance abuse is very common among people with bipolar disorder, but the reasons for this link are unclear. Some people with bipolar disorder may try to treat their symptoms with alcohol or drugs. Substance abuse can also trigger or prolong bipolar symptoms. Panic disorder can also co-occur with bipolar disorder. Its symptoms are sudden onset of intense fear lasting 5 to 15 minutes. This fear must be recurrent and unexpected. Bipolar disorder also occurs with ADHD. However, the symptoms of ADHD, such as restlessness and easily being distracted, are persistent, whereas those of bipolar disorder are episodic. Finally, it also occurs with anxiety disorders such as PTSD and social phobia. Biological, genetic, psychological, and environmental causes. Individuals with bipolar disorder have varying levels of neurotransmitters that cause mood disorders. Dopamine affects the reward centers of the brain and is involved in the shifts from mania to depression. During a manic episode, dopamine levels are increased, whereas a decrease in the dopamine leads to an onset of depression. Glutamate is an excitatory neurotransmitter, and certain regions of the brain show elevated levels in bipolar disorder. GABA regulates the activity of serotonin and dopamine, and studies show that the GABA activity is reduced in bipolar individuals. Norepinephrine controls stress, and higher levels are linked to manic episodes. Serotonin is found in lower quantities in people with BD. Bipolar disorder is a highly inheritable disease. If a monozygotic twin is bipolar, his or her twin has a 40 to 70% likelihood of developing it. First-degree relatives have a 5 to 10% chance of developing bipolar disorder. Changes in brain structure occur in bipolar patients. In bipolar disorder, sleep disturbances are characterized by two things: decreased REM latency and severe insomnia and severe hypersomnia. The sleep loss acts as a triggering factor, that is, it causes the manic episodes. It also acts as an augmenting factor, that is, it also worsens the mania. The relationship between sleep loss and mania is bidirectional. That is, the capacity of sleep reduction to cause mania and of mania to reduce sleep is a self-reinforcing mechanism. Another cause of bipolar disorder is cognitive errors. According to Aaron Beck, individuals with bipolar disorder make the worst of every situation during their depressive phases. They are prone to make negative thoughts about themselves, the world, and the future. These generalizations result in an inability to regulate emotions, solve daily problems, or solve conflicts. Life events such as loss of job or death of a loved one may trigger the initial onset of bipolar disorder and may also be the cause of recurring episodes. An increasingly recognized causal stress is abuse during childhood. Certain life events may trigger bipolar disorders in some people and not in others. This is explained by the stress vulnerability model. It says that a genetic predisposition towards a disorder and an environmental factor combine to trigger a disorder only if the threshold for the disorder is reached. The absence of a supportive relationship can be a major factor in the development of bipolar disorder. Going to university, moving to a new town, family arguments, and separation from a supportive partner are all potential triggers. Despite the management of episodes, the aim of treatment is to prevent future episodes and prevent self-injury. Mood stabilizers are usually the first choice to treat bipolar disorder. Lithium is a naturally occurring salt which is a mood stabilizer that has been used since the 1970s to treat mania and prevent mood cycling in adults. It can cause some side effects such as restlessness, dry mouth. Anticonvulsants, which were used to treat seizures, can also be used as mood stabilizers. Common anticonvulsant is valproic acid. Medications for insomnia are also used to treat bipolar disorder. Electroconvulsive therapy, formerly known as shock therapy, involves delivering electricity to the brain to cause a seizure. ECT has a more rapid onset than any drug and is one of the best proven treatment options in acute manic states. Though this used to have a stigma attached to it, in recent times its administration has greatly improved. Typically, it's used when medications aren't effective, the patient has had an adverse reaction to other medications, or the patient is severely suicidal and needs to be treated immediately. Before ECT is administered, a patient takes a muscle relaxant and is put under brief anesthesia. ECT treatments last from 30 to 90 seconds. ECT also has some short-term side effects such as confusion, disorientation, and memory loss. The relapse rate is high in ECT and therefore should be followed by medication and psychotherapy. Psychosocial treatment in conjunction with medication is the key to preventing a relapse and promoting healthy emotional growth and development. The three major psychosocial therapies, CBT, FFT, and IPSRT, have four basic aims. 1. Educate the family. 2. Teach the patient communication skills. 3. Make them adhere to their medication regimes. And 4. Teach them how to recognize their symptoms early on. Cognitive behavioral therapy helps people recognize negative thought processes and unwanted behavioral patterns and gives them strategies to change their thoughts and actions. They are taught to avoid stressful situations that provoke mania and that make them vulnerable to depression. In CBT, you are taught cognitive restructuring through verbal communications. Therapeutic learning is done also through role-playing and exposure and behavioral experimental assignments. Family-focused therapy is the best studied psychosocial therapy for adolescents with bipolar disorder. There are 3 modules in this therapy. In the first module, the clinicians discuss the biological and genetic causes from a vulnerability stress perspective with the family members. In the second module, patients and relatives learn communication skills for dealing with intrafamilial stress. Finally, in the third module, participants learn a framework for defining problems and fixing them.